An update. Makhala, very good morning to you.
Good morning. Good morning, Desiree. Yes, of course, we are coming live from the Free State Department of Health just to check what is the latest development in terms of checking and ensuring that the department is curbing the spread of the coronavirus. And we would understand that, Desiree, starting from October, we have started seeing numbers increasing in the province, and even the department even issuing a warning saying that it is concerned with different areas, especially the social gathering places, saying that numbers are increasing, especially coming from those areas. And we have seen that the department has also embarked on the road show, trying to visit different areas in ensuring that they try to curb the resurgence of infections of the coronavirus. But with me here, I have Dr. Semi Mukwena, who will take us through what the department has planned in terms of ensuring that it stops these infections in the province. We know that in the Free State, numbers have started increasing, even though that the president yesterday did not mention the Free State as part of those provinces that have been highlighted as the hot spot. We know that the province is not yet out of the woods, so the province is trying to ensure that it intensifies measures to ensure that this festive season numbers do not increase because of this second wave coming in currently. We have Dr. Mukwena here who will take us through some of the plans. Dr. Mukwena, thank you very much for joining us. Just take us through the plans that the province has to ensure that you curb the infections in the province.
Thank you so much for an opportunity. The province has already started from last week in terms of finalizing the resurgence plan with the help of the National Department, all the other stakeholders that are involved working with the department, like your WHO, the University of the Free State and others. And this has been to make sure that we are ready to tackle the resurgence. Part of the issues that I think was tackled and finalized in that plan was to make sure that we have about 7 indicators that we are monitoring, and maybe just few of them is the new cases, the admissions, and we're also looking at the number of deaths that are increasing and so on. But also we have about 9 areas or functional areas that there's a province in the resurgence plan we are looking at and tackling. Part of it is governance and leadership from all the provincial level up to the sub-district level. That has been dealt with. We are looking at port health and environmental health, looking at the borders and so on that are bothering our province. We are also looking at the issues of AP and surveillance, making sure that we are monitoring where the cases are increasing, making sure that we are tackling. And also, maybe lastly, there are 9 of them, but one of the important one is facility readiness and also the case management, to make sure that our facilities are ready to tackle, to accept our patients, that we are ready when that happens.
Talking about different centers, I remember in the past the department engaged or embarked on building centers to make sure that people who are infected by coronavirus will be taken there. How far is that process? Has the department finished with centers? I know there was a center in Bloemfontein, in Welkom.
In terms of the facility readiness, what we have is that most of the facilities, I think we have been embarking in roadshows and opening some of these facilities. But you must remember that we are also looking into still taking care of our general patient. So we have phases that will follow. So in the alert phase, there are facilities or beds that will be open in different districts. All the districts within the province have already beds available for the COVID patients. But this will be done according to the level of how the infections are increasing, up to the place where we'll be opening our surge facilities. So each and every hospital, what we did as a province when we started is to make sure that we improve the facilities that we already have, also to increase the capacity, but also to make sure that after COVID we have facilities that we can use also as for a hospital. So most of the facilities are ready, and there are also alternative plans if those facilities are already fully occupied. So, but that will be done in phases.
Now, which are the problem areas in the province? We have seen in the past that the department did mention that Mangaung was a hotspot. They did mention Heidedal as one of the hotspots. Currently, where are we standing? Which are the problem areas in the province?
I'll just highlight in terms of the general overlook. So in the province currently, Mangaung as a district is a big problem, but particularly in Mangaung, Bloemfontein is a big problem. If you look at our statistics, Bloemfontein constitutes more than 30%, actually 35% of our cases in the province itself. So it continually becomes our big problem. And the big issues is obviously the super spreader events that the president spoke about yesterday, where we have a lot of areas of entertainment, where people do not wear masks, where people would also the use of alcohol is big issue. When you look at the previous week with the increase in cases, we realized specifically around Bloemfontein, the ages between 20 up to the ages of 35 are the ones that have increased. And these are the generation or the people or the group of people who tends to attend the super spreader events. So Bloemfontein is a big issue. In terms of Lejwe-Leputswa, which is also one of the big worrying districts that we have, Welkom continues to be a big problem. We know that people will be coming home from different areas, but also Beltfontein is also a big area that we are concerned about and we are worried about. We are starting to see Bothaville becoming a problem with increasing infections. In terms of Fesile Dabi, Kronstadt is a big issue, but I must just highlight Viljoenskroon, particularly Ramulutsi location, is one of the places that we are worried about. Obviously Sasolburg, because of the interprovincial movement between Gauteng and Sasolburg, is continually an issue. In Thabo Mfutsanyane, particularly areas that are surrounding the borders, your Sesotho area, particularly the Fixburg, the Lady Brand areas, are the areas that we are concerned about. And Bethlehem as an economic hub of the TM or Thabo Mfutsanyane becomes one of the issues that we are concerned. Lastly, Harib, the big issue has always been in the Letsimeng and the Mohokare area, and particularly among the professionals, and particularly because of the proximity between the Northern Cape and also the Eastern Cape, that we continually to have problem with that. So those are the areas that we are looking at, and we are cautioning and asking people in these areas to make sure that if you have any symptoms, go and get screened and tested, stay home, make sure that you do not go to work or interact with anybody. And over the festives, if there's any person who comes in or in the house have any problem, make sure that you go to your nearest center so that we can provide help.
And now, how is the province standing in terms of a number of infections, recoveries, and number of deaths as of the latest stats?
Yeah, as of the latest stats, currently we are having 59,854 in terms of the number of cases that we are having in the province. We are having around 2,084 deaths currently as the number stands. Our recovery rate is just around 90%, with just over 53,000 that has been diagnosed. And I think the biggest is then the Mangaung in terms of the 27,000 number of cases in the whole of province. And as I said, we have seen close to just 45% increase from the previous week to this week in terms of the number of new infections.
That is Dr. Semi Mukwena from the Department of Health taking us through the numbers and the plans that they have in terms of curbing the second wave. But we also, it will be interesting to check tomorrow in terms of the parks and all of those areas, because we did see Mangaung Metro municipality releasing a statement about parks, saying that parks that belongs to the municipality will not be opened this festive season. But we do know that there are different areas of social gatherings, so we'll continue to monitor that and see what happens in the province. With that, is back to the studio.
Thank you so much for that update from the Free State. And now to the Eastern Cape.